Should we start therapy or we should wait for the natural course and the child will develop by himself?
Hi everyone, this is Dr. Sonam Kothari. I am a Pediatric Neurologist, a Behavior Analyst and a Special Educator. I'm a co-founder of Butterfly Learnings.
There is a lot of discussion on should we wait or we should start with early interventions. Just to give you a logical explanation for this, the child, just consider the language development of the child. By 2 years of age, the child is able to make 2-word phrases. By 4 years of age, the child is able to make a complete story. At 2 years, the vocabulary is around 50, 100 or maybe 200 words. But at 4 years, the vocabulary is around 1000 to 2000 words. Now, just imagine if I got to understand that my child is not developing the language milestones by 1.5 years of age. Now, the delay between 1 to 2 years of age is only of 50 to 100 words that are delayed, or 200 words max vocabulary that is delayed. But now, consider I understood that my child is delayed at 4 years of age. Now, the vocabulary has already grown to 2000 in a neurotypical child. To cover up for a therapist, 500 or 200 vocabulary words or the words, it's easier. It's easy. But to cover 2000 words, it takes a lot of time. And the moment when I say it takes a lot of time, and suppose you are initiating therapy at 3.5 or 4 years of age, his time is also going. So by the time with intense therapy, I'm able to reach the vocabulary of 4 years of age, maybe in 2 years or 3 years time. But still, the child has gone to 7 years. And now in that 7 years, even the academic development starts. Even you have to be in first standard, second standard, you have to learn phonics, you have to learn mathematics and so on. Now, should I focus on language or should I focus on academics? Basically, what I'm trying to tell is, as the age increases, the domains the child has to learn also increases, and the components in each domain also increases. So the moment you start an early intervention, less amount of developmental milestones have to be covered, and the therapist can do it faster. But if you start the therapy at a later age and you expect that the child should be age appropriate, it will take a lot of time, because already he should have a vocabulary of 2000, he should be able to do a lot of pretend play and creative play, he should be able to do maths and English as well. All these things, it will take time. So always it is better to start the therapy as early as you can diagnose. Second very important thing is, if your language development is delayed, even if your child is super intelligent, he might understand phonics, he might be able to read, he might be able to intervene as well, he might be able to interpret as well whatever he is reading. But if he is not able to understand the instruction only in the language given, or he is not able to express himself in the language, even his education goes down. If I'm not understanding only, how I will do whatever is required in academics. So language is the base to develop your academics. If your language is not developed, with time your academics will also go down. So always remember, early intervention is the best choice rather than waiting for a natural course of development. Thank you.